So we're cupping the quads, and specifically we're cupping a quad muscle that crosses the knee and the hip joint. So when that muscle called the rectus femoris is put on stretch, the knee is bent and my hip is extended. So that's the tissue that we're addressing with this cupping technique. So you're going to take some cocoa butter, about fingernail amount, and you're going to spread it over your mid-thigh all the way up and down. This gives the cup a nice lubricant to easily slide on the leg. Now you can use the bigger cup or the medium-sized cup. I prefer the medium-sized cup so that we can progress to mobilization with the cup. So at first, you can relax your legs, straighten out the knee to relax the muscle, and you can just explore up and down the thigh. Where do you feel sensitivity? Okay. Now, for the cup purposes, it's more aggressive or more suction if I squeeze the cup like this, then apply it to my thigh and then release it. That's going to suction way more. If that's too aggressive, then what you can do is you can just push the top of the cup, place it on the skin, release, and that's a less aggressive suction, okay? I put it on, I release, and now I'm ready to go. Okay, so now cupping at rest, I'm just gonna glide the cup up and down my quad muscle, okay? I can also pull up a little bit and do a little bit of a shake. And when you lose suction, you can just reapply. And so I am shaking as I move, okay? Now, that's just as like a warm-up. What we really want to get to, all right, is the cupping with movement. So because I'm going after this rectus femoris quad muscle that crosses my hip and my knee joint, I'm going to leave that cup on my thigh as I bend and bring my leg back, right? So I'm bending my knee and extending my hip. I bend at the knee, extend at the hip. Now be careful, you don't want to, as you extend to the hip, because this is limited, this tissue is limited, you're going to compensate by extending at the back. We don't want to do that. Keep a little bit of tension in the abdominals, so as you start coming back, you don't do this to get more motion, okay? So I can simply just suction the cup and go through that movement, or as I'm going through this movement, I can glide the cup up and down my leg. Another position that you can do this in is laying on your side. So I have the cup on, and I'm going to extend my hip as I bend my knee without arching my back. Okay? Again, as I do this movement, I can glide the cup up and down based on where I can reach. And I might have to reapply a few times, and that's okay. Okay? And I recommend that you do the cupping right above the kneecap, so lower down the quad muscle. Do the movement a few times, and then every few reps, you're going to migrate it up and do a few movements in different positions of the cup to really start to free that tissue for more movement.